Hello and thank you for joining us. I hope that you're safe and healthy. My name is Aida Munzati and I'm glad to be bringing you the Health Week series of the Presbyterian Church of East Africa, where we will be featuring different health topics. Well, in the history of the world, we have witnessed the worst scenario in the globe in the face of COVID-19. It has not only affected the lives of many, but it has shaken the socio-economic fabric of families, institutions, countries, and the society at large. Well, we are coming to you from the Chogoria Hospital, and on set I'm being joined by Dr. Franklin Gekunda, who is the Chief Medical Officer at the Chogoria Hospital and also a family physician. Thank you very much, Dr. for joining us and of course for the information that you're about to share with our audience.
Thank you to have me. I'm grateful to be here, and I'm happy to talk about COVID-19 as I see it in Chogoria Hospital. Yes. About COVID-19, we've not seen so many people, but we have about less than 10 whom we have seen, and we are still advocating the guidelines which are given by the Ministry of Health, and I hope even viewers are also adhering to those guidelines, social distancing and masking and washing hands so that we can all be safe.
Exactly. Now to our topic of discussion today, which is the socio-economic impact of COVID-19 on families, institutions, and the country. What would you say, how has the family been affected by COVID-19?
The families have been affected in various ways, starting from the long stay of the families, of the children who should have been in school, who are now staying at home, and anticipated the guardians and the parents were not prepared for them. And then here they are. And then they had to care for them in terms of food, in terms of healthcare, in terms of protecting them from offering protection, especially the girls' children. As you can see, I think you've realized they have been allies in teenage pregnancies, and they've been in school. This could not have been affected. And had these people been prepared, they could have prevented this. Then we have budgets are strained because depending on where most of the incomes of the people have been affected, because the people who depended on transport industry, hotel industry, some of them have closed, and salaries were reduced, and some of them lost jobs. So there's a strain in the family. And then there's conflicts, marital conflicts between the parents, probably arising from the reduced income and presence of people, of the husbands, who should not have, who other times was at work, but now he is here, and then they were not preparing for it, so we find a lot of marital conflicts in families, which is not good for this country. We've been leading them. We can see, we have seen even deaths have resulted from this.
Now there is the aspect of mental health.
Yes.
How would you say this one has come about as far as the family is concerned, the children, the father and mother?
I think these have been source of conflicts, and now have been stressors to those people who are predisposed to mental breakdowns. So they could also be stressors. You know, in mental health, a number of people are usually stressed by some factors. So this could be source of stressors, which could provoke patients to get into mental breakdowns. Yeah.
And as a family physician, how can you advise families to counter this?
I think it depends. There's no general consensus on this, but I think seeking counseling from the relevant people, it can help, because we've done so to a number of families here, and they are doing well.
Yeah. Okay, now going to the institutions, we've just talked of families.
Yes.
And of course, this family, they're the same people that attend to these institutions. Talking of hospitals, you've just mentioned that your number of patients may be reduced during this COVID-19 period.
Yes.
How, in what other way has institutions been affected by COVID-19?
Institutions like schools and hospitals have been reduced have been affected because they have been reduced income. Because fewer patients were coming to hospitals, most of them were fearing to contract COVID-19, and therefore the income of the hospital reduced. So the hospital should look for alternatives, sources of income. Same way with the private schools, which did not have students. So they should look for alternatives, because we can't do otherwise. You can't go and get the students back without the approval by the ministry. Yes.
And now, what's your word to people, being the chief medical officer at Chogoria Hospital? Of course, there are those that are sick outside, even from the statistics from the Ministry of Health.
Yes.
There are those that are sick, but they fear coming to hospitals that they might be affected with the virus. What's your word to people outside there as far as attending hospital and seeking medical attention is concerned?
I think for me, it's for them, as long as they take the guidelines, social distancing, wearing the mask, washing hands, you are relatively safe. You should always go and get treated for your condition, because you might fear to get COVID. Excuse me, and the chances are probably very little or very, very small. Whereas when you stay at home, that condition you have might even kill you. So it is better you go for treatment if you need to go for treatment. COVID should not be an excuse. Yes.
Exactly. Yeah. Now, thank you very much for that. Let us now look at the institutions, not the institution, but the country.
Yes.
How has the country been affected as far as, maybe let us look at the economic stability of a country, let's say Kenya and other countries in the world?
I think it has been affected in a big way, because the hotel industry, where they were getting a lot of money and paying a lot of taxes, those taxes are not there. The transport industry, like the airlines, when there was lockdown, there were no plane going, so there was no income to them and to the government. So I think for the country, I think there was loss of income, a lot of loss of income in terms of taxes submitted. And I hope they will pick this after now that the lockdown is almost over. It will be back to normal. Yes.
And even as you've mentioned us going back to normal, just the other day we saw the president is trying to open the economy, but in bits. Yes. When we go back to normal, yes, or as we prepare going back to normal, yes, what's your advice to people? What should we look up to?
I think we should still stick to the guidelines to be safe. Yeah, because this is, as of now, we can say is a bad disease, because there's no definite cure. But as long as we are not far from the pandemic, we should keep those guidelines: social distancing, wearing mask, washing hands. We should do that until when we will be advised otherwise. Yes.
So it's an activity that should be going on and on.
It should continue.
Okay.
Yeah.
Thank you very much, Dr. Maybe you can just give your final words as far as the socio-economic impact on people is concerned.
So my final word is, I think Kenya's done great compared to other countries. We have not seen so many death rates as other countries. I think we should keep up. And we should not be discouraged. We should resume our duties and work hard until we go back to normal, because COVID-19 is not the end of the world. Yeah.
Well, thank you very much, Daktari. Indeed, it has been brief and to the point. And I hope that you at home, you have also grasped something. And as Daktari has said, COVID-19 is not the end of the world. What I'll tell you at home is just that keep on adhering to the regulations of the Ministry of Health, and all is going to be well. As I said, I'm Ida Munzati, and I'm very glad to be bringing you the series of Health Week of the Presbyterian Church of East Africa. We are taking a very short commercial break, and when we come back, we will be discussing kidney diseases and how they are related to non-communicable diseases. As I said, we will be discussing different health topics throughout the week. Stay tuned.
It takes courage to stand up for the society.
To quote Barack Obama, we are borrowing the future of our children.
Going miles to offer free positive advice for reforms.
That these parties are owned by individuals.
Rebuking injustices both from the rulers and citizens.
Having majority and minority. So all these discussions definitely goes through a people-centered process.
Public is now bigger and better. Every Thursday from 7:30 p.m. to 8:30 p.m. tune in to CAC TV and join Cornelius Omuse with Kenyans from all affiliations and be part of the reforms journey on matters, politics and governance.
Welcome back, and it's the special series of the Presbyterian Church of East Africa Health Week. And as said before we went for the break, we will be discussing kidney diseases and how they are related to non-communicable diseases. Now, reports indicate that chronic kidney diseases are the leading cause of death, or the sixth leading cause of death worldwide, claiming about 2.4 million lives yearly. This is worldwide. But according to the statistics by the Kenya Renal Association, is that 4 million Kenyans are living with chronic kidney diseases. And it's predicted that by 2030, this number will have risen to 4.8 million. Well, as said earlier, we are at the PCA Chogoria Hospital, and on set I'm still with Dr. Franklin Gekunda, who is the Chief Medical Officer at Chogoria Hospital, and is going to help us understand why more and more Kenyans are being diagnosed with chronic kidney diseases that in many cases leads to kidney failure, and of course how we can go about it. Dr. Thank you very much for staying on set. And maybe to start with, we've just seen the numbers, 4 million people in Kenya living with chronic kidney diseases. Maybe you can just touch on that for our audience to understand these numbers.
Thank you, Enda, for having me. I think the number is increasing drastically because of increase in the number of lifestyle diseases, namely diabetes and hypertension. Why diabetes and hypertension is, if diabetes is not well controlled, it eventually leads to chronic kidney disease. If hypertension is not well controlled, it eventually leads to chronic kidney disease. Well, there are other causes other than those. Those are the leading causes in our country. Otherwise, the other cases like acute glomerulonephritis, congenital inherited disorders, and so on. But those ones are minor. The biggest is diabetes and hypertension.
Okay, so
and also HIV also contributes to the number of chronic kidney diseases. Yeah.
Okay, thank you. So we've just mentioned chronic kidney diseases.
Yeah.
Let us know the types of kidney diseases.
There are those which are acute and chronic ones. Yes, there are some which are chronic from the beginning, and there are those which are acute and they can be chronic, or it can finish when it is acute. It can come and go, like acute glomerulonephritis. Yeah, but a number of acute glomerulonephritis change to chronic glomerulonephritis. But for diabetes, it is chronic, and for hypertension, it also causes chronic kidney disease.
Okay. Before we even go to the symptoms, let us just take it back a little. For our audience to understand better, just tell us the functions of the kidney.
The functions of the kidney is to balance the water and salt in your body, because it will remove the excess water and the excess salts in your body, and also remove the waste products which have been waste products of the body. Yes. Yeah.
And what causes kidney diseases?
Now, what causes kidney diseases is when the small unit which filters the waste products, which also reabsorbs water and removes the excess ones. After that one is destroyed or is damaged by different mechanisms, is the one which now leads to chronic kidney disease.
And what about the symptoms?
The symptoms are usually body swelling, and loss of reduced amount of urine produced, and sometimes passing urine which is blood stained consistently, and mainly those ones. And you can go to a clinic, and then you are told that you have hypertension, and that can be part of the kidney disease. Yeah.
And just touching on the non-communicable diseases, these are, you've mentioned HIV, you've mentioned diabetes and hypertension. Why is it that these people living with NCDs are at high risk of kidney diseases?
Because a number of them are not well controlled. A number of people are not well controlled despite going to the hospital. Because the problem of this non-communicable disease, like hypertension and diabetes, there's no big symptoms. They don't cause, for example, a lot of pain, like headache, to make the patients make sure that when the blood pressure is high, you should go to the hospital, or you should, when he was told to go to the hospital, keep the appointment of the doctor. Because sometimes some say, because I was not feeling anything, I didn't go. We see people who come when they have stroke or when they have end organ damage. They didn't go back to the clinic after they were told by the doctor to go back, with very high pressures, or some come dead, simply because they did not feel any pain. You know, this is because they did not know the value of going back to the clinic and making sure that their pressures, their sugars are well controlled to prevent damage to end organs like kidney or like the heart. Yes.
So it's very important to keep on going for checkups.
Keep on going to checkups, taking medication as instructed, and to avoid mitishamba. Yeah.
Okay. Now, you've said that swelling is one of the symptoms of kidney diseases. Would you say that the symptoms are similar from patient to patient, or they differ?
Well, when you have swelling, it does not mean that you have kidney disease. It's not only that symptom. That has to be, you have to go to the hospital and it has to be tested, and then you have to, the doctor has to confirm whether it's a kidney disease. You can have body swelling because of other things, because of heart problem, because of a liver problem, because of other things. Yeah.
Okay, so I don't know whether it's a myth or a fact, the issue of kidney diseases being genetically inherited. Are there chances of me having a kidney disease if my father had it?
Yes, there are some which are inherited, but there are not many. There are very few, like polycystic kidney disease. Yes.
Oh, so
it's not common. It's not common, but it is there. And I've seen one. Yeah, it's not common. Yeah. There are not many. Yeah. It depends with what kind of kidney disease. If we say you have polycystic kidney disease, which runs to kidney disease, chronic kidney disease, I would say, well, yeah, you are at risk. But if it's not, if the other kidney disease, if it was if you have diabetic nephropathy, it's not necessarily that you have a kidney disease if you manage your diabetes well. Even if your dad had a kidney disease because of diabetes or hypertension, and you happen to have also hypertension or diabetes, if you manage your diabetes well, if you manage your hypertension well, you don't have to have it. Yes.
Okay, so we've looked at the causes. What are some of the risk factors that you'll say will trigger kidney diseases?
One, the risk factors, I think risk factors include even, because diabetes, even if it is a risk factor, smoking, and also old age. If you're over 60, you're at a very high risk. That one, there's nothing you can do about it. Or there's a way of doing away with age, so you can't do anything about it. And then there is also, you should, if it is hypertension, you should get treatment for hypertension by a well-informed health practitioner who will make sure that you get the right medicines. Because there are some medicines for hypertension which can protect the kidney than others. Yes. So you should go to a health practitioner who can know that, so that you'll be given the right medicines for as long as you have hypertension.
Okay, you mentioned lifestyle before, and of course many of the NCDs are related to lifestyle. Yes. Let's touch a bit of food, the types of food that people should avoid, maybe to keep off from kidney diseases.
Yes, that is, it should take well-balanced diet, and avoid being overweight and obesity, and you have adequate exercises. That is, you keep fit. Because if you keep fit other parts of the body, the kidneys will also be fit. So you avoid the risk factors which predispose to diabetes and which predispose to hypertension, in addition to keeping away from cigarettes and excess alcohol. Yes.
Thank you very much. Now, maybe to your word to our audience out there, maybe someone that is living with a non-communicable diseases, what they can do, or someone that is has failed kidneys or a kidney disease.
Well, what I can tell them is you should take your ailment, if it is hypertension, seriously. You should take medicines as instructed by your doctor, and you should keep appointments so that blood pressure does not go high, because if it goes high this month in January, it causes some degree damage which you may not tell to a kidney. Now, if it goes up again, it becomes accumulative, so you avoid it going high, and by keeping appointments. And if your doctor is not keeping your blood pressure controlled, ask questions. Tell them you'd want it to be controlled. If it's your sugars, you should get your sugars controlled if you are diabetic. Because if they are consistently high, your organs, including the kidneys, are getting damaged. But not the doctors. You are the one. So tell him you'd want your sugars to be okay, so that he can, if he has a reason why, he'll tell you why he's not controlling it. Yes. Yes.
Thank you very much, Daktari, for sharing that very critical information with our audience tonight. So So as we've heard from Daktari, more healthy eating is advised, frequent checkup and frequent exercise. And remember that what you put in your body is exactly what your body is built of. So be wise and be healthy. That is all we had for you for this episode. Join us again tomorrow for more healthy tips and more health topics. My name is Aida Munzati, and as I always say, your